Hi class, Dr. Jim here. Chapter 24. So we've now got into the last two chapters, which are going to look at viruses. Chapter 24 is mainly going to deal with the DNA viruses. So we're going to look at things like herpes and some of the other herpes viruses. We're going to look at the hepatitis B. We're going to talk a little bit about the papilloma viruses, which causes warts. And you may have heard of HPV, which can cause cervical cancer, among other cancers. And then we're going to finish up with Parvovirus, which is one that we really don't think too much about except when our dogs and cats are sick. But it does infect humans too, and we'll discuss a little bit about that. But today we're going to be primarily talking about the DNA. And that's how viruses are classified. That's the main classification. We separate DNA viruses from RNA viruses, and then we break them down into how the DNA or RNA works. And so most of today, and like I said, all of today, all the viruses that we're going to be discussing in this lecture is going to be looking at the DNA viruses. Most of them are double-stranded, except Parvo, that's a single-stranded DNA virus, and then, they kind of branch off from there based on whether they have an envelope or no envelope. And if you remember back to chapter 6, we talked all about those different things. I'll refresh a little bit about those, but hopefully you have enough of a background. If you need to go back to chapter 6 and kind of look through that again, you might want to do that just to kind of refresh up a little bit on the viruses. If there's something that I don't talk a lot about today, it's just because there's a lot of material just kind of going through the various viruses and looking at what we're discussing. Okay, so let's look at what we're discussing today. The first one is how are viruses classified, and again, the big thing is DNA versus RNA, and then I'll take you into the DNA viruses and show you that they're based on do they have an envelope, no envelope, single-stranded, double-stranded, and all these other things. RNA is the same way. We'll get into RNA in the next lecture. So chapter 25, we'll look at the RNA viruses and take a look at how those are classified. We'll then get into quickly how viruses infect. And so again, we'll get into that whole idea. You've got to remember the lytic cycle. The lytic, you got to attach. And so the attachment. So think of the spikes, the little keys binding to the receptors, which are the locks. And if you bind the keys to the locks, voila, you can get in. And then the virus can do its damage inside the cell. And then finally, we'll look at some of the DNA viral diseases. I've already mentioned a few. Again, another one we'll be discussing that I didn't mention was smallpox or the pox viruses, herpes viruses, lots of herpes viruses, the hepatitis B, papilloma viruses, and then finally finishing up with the parvovirus today. And so those are some of the different diseases that we'll be discussing. But primarily, most of this lecture is going to be on the different herpes viruses, and there's more than just the two. And you may not have realized this, but chickenpox is a herpes virus. So probably most of us, I would say probably 95 to 99% of us have at least one, maybe even more than one herpes virus in us that's inside of us. And so when we get those things, it stays with us the rest of our lives. And even though we have a good functioning immune system, the immune system keeps us quiet, keeps those viruses quiet for a lot of times. But when we're weakened, that's when these things come out again. And so there's triggering mechanisms and other things that allow these viruses to keep coming back. And so they hide. Remember the lysogenic, the hiding phase, they hide and then they can come back out again. And so that's what we're going to be looking at today. All right, so again, virus human infections and diseases. And again, DNA or RNA molecules are surrounded by the protein. That's the capsid. The capsid is the protein coat. And then some of them have the envelope. And so today we're going to be looking at the DNA viruses. Here's the DNA. And again, you're going to look at shapes. And then do they have a envelope or non-envelope? You remember the envelope are called the envelope viruses. They have a membrane that they take from the cell membrane of the infected cell. And then the naked are the non-envelope viruses. Okay. All DNA viruses are double-stranded except the parvovirus, and I'll bring that up again, and that's always a good question to ask on a test just to see if you're paying attention, which is the single-stranded DNA virus. And then all RNA viruses are going to be single-stranded. There are a few that are double-stranded, and those are the reoviruses, and those are going to be the ones that cause the infantile diarrhea. Sometimes you hear about it causing outbreaks of diarrhea, especially in contaminated water and things like this. And again, we're going to discuss that in chapter 25. All right, and then again, medical considerations that we have to think about with viruses. Again, a lot of times they're limited to a certain cell type. Remember, the cell receptor is a lock. If you don't have the lock on the cell, the virus can't get in. And so that's the key, is that some viruses have a kind of like a janitor's key that can get into, or master key that can get into every lock, and some of them are very specific, and that's why they only infect certain cells. Most of the DNA viruses are budded off the nucleus, so that means they come off the nucleus and then they go out. And then DNA does its dirty work on the inside of the nucleus because, again, you got to go through transcription translation to get it to make the proteins. And so a lot of times the DNA virus gets into the nucleus first, makes all its products, and then leaves the cell. Okay, and then most RNA viruses are in the cytoplasm because you're already at the RNA stage. You don't have to go through that transcription translation. You can already begin translation. And so translation begins very quickly in those guys. You make lots of proteins, and then they can be ready to go out and infect more cells. Again, some viral infections are asymptomatic, and again, we'll discuss some of those where you don't see any symptoms and we've been infected in our lives and we don't even know it. And others can be life-threatening. So some can be very serious and cause life-threatening illness or disease and could potentially kill us. And again, most many viruses are human origin, but there are some that we worry about. And so obviously you've probably seen the movie Outbreak or Contagion and some of these other movies out there, and they always seem to spread from like a monkey or a primate to a human. And that's not uncommon. It does happen, but most of the time when we're thinking of viral disease, it's human to human, and human are the origin of these viruses. So humans are going into areas that they're not supposed to be. They pick up these viruses and then they infect other people by transmission. And we'll talk about the different routes of transmission today as well. Okay, so again, viral infections, there can be lots of different things. So you can see all the different areas where we can be infected by viruses. Really, any tissue in our body can be infected by a virus. And again, I could go and spend all this time telling you all the different viruses. You can pause it here and look at all the different ones. But again, lots of different viruses. Again, invasion is at the portal of entry, so typically it's respiratory or the mouth. That's where we get most of them. However, some can be injected through an animal vector if we're talking about mosquitoes or other insects. Some can be through the breaks of the skin. You can think of, if you're thinking fluid transmission, if you are a nurse and you're going to be treating, or a doctor, and you get a needle stick, that is obviously a way of transmitting, but primarily most of them are going to be airborne or sometimes through liquids or food or other things like that. But most of the time we're thinking airborne or respiratory type of viruses. Now, most of the manifestations are very typical and pretty much the same, and so there are a lot of times we describe them as flu-like symptoms because flu is a virus and you get a lot of the same things. But it includes things like rashes, fever, muscle aches, respiratory involvement, swollen lymph nodes, and you've all suffered from a cold now and again, and those are the typical viruses that we get every year. And again, we get the same symptoms over and over again. Again, what our body uses to defend is combined action of interferon. That's the chemical that stimulates the immune system. Antibodies, which are produced by the B cells, and then the cytotoxic T cells, which go in and kill. And primarily we're going to be talking about cytotoxic T cells because those are the ones that are going to go in and kill the infected cells, because they're going to recognize that this cell is damaged, it's got a virus in it, we need to kill it before the virus spreads. Antibodies or B cells work really well at trapping the virus outside the cells, but once it gets inside the cells, that's the role of the T cell. And so we're going to see more of the T cells, but again, B cells with the antibodies do a very good job of trapping viruses before they even get to the cell. And that's probably one of the good things that we have, and why we get vaccinated and all these other things, is to make these antibodies so they can't get to the cells before they can infect. Okay. So many viral infections have a rapid course, and that is the lytic cycle. So when you get sick, that's the rapid lytic cycle. It spreads to other cells very quickly. You get sick, you clear the infection, and then it lasts. Some do establish long-term persistent infections, and this could be something where you're suffering for a long period of time. Others will go into what we call the latent infections, where you get infected and then it goes and hides. Great example, herpes virus. You get these infections all the time. You get an outbreak, it goes away. You get another outbreak 6 months later, it goes away. Over and over again. Chickenpox, great example. Chickenpox, you get the infection, you get the bumps all over you as a little kid. That goes and hides for 20, 30, 40 years, and then it reappears as shingles later in life. And so that's another virus that stays with you for a long period of time. And these are all latent type of infections. So they go and they hide, and then they come out again over and over. Now, chronic infections are a little bit different, because chronic means you have it, you basically carry that virus for the rest of your life. An example of that would be probably like HIV, where again, a lot of times people think of it as latent, but there is always a little bit of virus in the body. And again, as it increases in transmission and moving from cell to cell as it progresses, that's when the disease really hits and you get into a level where your white blood cells drop. And that's the signal between just HIV positive and having AIDS, is the level of white blood cells. And when you drop below a certain level, that's an indication that you're now going into the secondary phase, or what we call the acquired immune deficiency, because you've lost part of your immune system. And so that would be a chronic infection, one that stays with you the rest of your life, and you kind of always have a few symptoms here or there, and that would be one of those things. Okay, and this just shows you over here the persistent infections or goes into malignancy, can cause cancers. You can have the chronic infection where they're constantly made over and over again, the latent infection where it goes and hides, and it gets into the latent, and then again releasing through the lytic cycle. And so we're going to be discussing all these different things. These are the typical ways that viral infections happen. Most of the time when we're talking about colds or flus, you have that lytic cycle. It causes the massive inflammation. You get the symptoms, the sickness, and then you clear it with your immune system, and then you're better, and then you're ready to face your next virus that you come in contact with. There are some that are latent, and then there are some that are chronic as well. Okay? All right. So some viruses are oncogenic, meaning they can cause cancer, and this is where viruses get into the DNA and then can get into some of those genes, which can then cause problems. And so obviously the one that most of you guys are probably aware of is HPV, or human papilloma virus. There's about 5 to 7 strains out there that we know can cause cancer. And again, early detection is the way to fight or combat this problem. And it's a sexually transmitted disease. It passes through unprotected sex, and so that is how people get it. There are vaccines for it now, and I highly recommend those that are at the age that you can get that vaccine to get vaccinated for it. However, if you already have the disease, you might not even know it. You may be asymptomatic, but again, you always want to keep checking, because that's the case where you can look to see, are you going to be at risk for developing cancer. Some can cause cross the placenta, and we call that teratogenic, which means that it can cross the placenta and infect the child. And again, there are some viruses that do that, and that shows you here congenital herpes, which can actually cross the placenta and cause blisters on the skin of the baby. And there are some, again, that can cross and do those things. And so here's the mother with an active case of herpes. She delivers, and now the baby gets it from the natural delivery. Now, if the doctor was smart, he would choose to do a cesarean rather doing a live or a natural delivery. Now, this obviously would be, hey, don't do it. But sometimes you're asymptomatic, or you may have the virus and the doctor doesn't know. You don't have any symptoms at the time, and it still can spread. So if you do know you have the virus, you always want to make sure your doctor knows before any of these different things, because some of these viruses can pass to the baby or across the placenta and do that. Now, diagnosis is a lot of times looking at the symptoms. It's hard to isolate because we have to do special techniques to isolate viruses, so that's always a difficult thing to do. It's not as easy as just growing it up on a plate like bacteria. And again, we do have tests for things. We can test for antibodies in the serum, in the blood. We can also test for some antigens, and that's how some of these tests, like the HIV test, it's looking for antibodies that your body has produced against HIV to see. If you have a level that is detected, that means you're HIV positive. If you don't have any antibodies that are detected for HIV, that means you're negative. And so that's how they do the test. And so it's typically a blood test looking for the number of antibodies in your body. Okay, now again, to survey the DNA viruses, we're going to take a look at some of these different ones. Here's how the DNA is organized, and we'll talk about this in just a second. But again, they're categorized according to their nucleic acid, so that's where we separate our DNA from our RNA. And again, we'll talk about the RNA next time. The DNA has 7 families, where RNA has 14, so there's many more RNA viruses than DNA. And DNA viruses causing human disease include envelope DNA viruses, non-envelope DNA viruses, and then the non-envelope single-stranded DNA viruses. And so that's kind of how we look at these things. And so the first one, the DNA virus, again, we're going to look at the envelope first, and these include the pox viruses, the herpes virus, and the hepatitis B virus. Then we'll get into the non-envelope. The double-stranded genome include the adenoviruses and the papillomaviruses. So again, that's the warts and then also the one that can cause cancer. And then the last one is the single-stranded naked. That's the parvovirus. And so these are the families that we're going to look at today. We're going to talk about a different number of different diseases associated with these things. Primarily, we're going to spend most of our time looking at the herpes virus because typically we either have at least one or multiple herpes infections going on in many of our patients that we're treating or in ourselves. And so we'll look at that and talk about some of the different diseases that we see there. Okay, so again, the envelope DNA viruses, the first ones we're going to be talking about are the pox viruses. This includes smallpox, monkeypox, and cowpox. Chickenpox is actually a herpes virus. That will be the second type of virus that we talk about today, the herpes viruses. And again, there's a number of different herpes viruses out there. I believe there's at least 8 different herpes viruses. There's probably even more than what is categorized right here. So don't quote me on that exact number, but I think it's pretty close to 8, and there might be a few more. And then finally, we'll finish up with the hepatitis virus, which is hepatitis B. Hepatitis A and C are both RNA viruses, and we'll discuss those in chapter 25. Okay, so the pox viruses, again, pox viruses are the largest of all the animal viruses that infect us, and they cause these eruptive skin pustules called pox that leave scars. And so, again, most of us have never seen smallpox or monkeypox, but there are a few cases rarely seen in the world. Again, there are some areas in the world where smallpox is still endemic in that, and there are some countries that still vaccinate for it, and I'll explain that here in a few minutes. But here in the United States, it's rarely ever seen, and so this is why we always fear smallpox could be used as a biological weapon, because we haven't vaccinated for it, and it can be very debilitating to a lot of people. So if you spread this through a population, this could cause a serious crisis, okay? Again, it's the largest and most complex of the animal viruses, has the largest genome, it's double-stranded DNA, and it multiplies in the cytoplasm in factory areas. And so areas where you have lots of proteins, ribosomes in areas in that area. And again, specificity for cytoplasm of epidermal cells and subcutaneous connective tissues, that's where you're going to see the virus. It causes the eruptive pox, and that's what you typically see. Here's the virus under the electron microscope. It kind of has that barbell shape on the inside. It has, again, the envelope on the outside, an outer membrane, and then the capsid is this kind of the barbell shaped thing that you see on the inside, and then in there is the DNA. Okay, the first case is smallpox, and again, this was the first virus to be completely eliminated by vaccination. And so again, there are some places that still vaccinate, and I'll point that out. But in the United States, we have stopped vaccinating since 1972. The exposure through inhalation or skin contact, so again, this can be a respiratory or skin contact, and there are 2 different types of viruses associated with it. Typically, you get fever, malaise, frustration, and a rash associated with this, but there are 2 different strains, the Varicella major, which is, again, a highly virulent, which can cause toxemia, shock, and intravascular coagulation associated with it, so it's a pretty nasty guy, and the Varicella minor, which is less virulent. But again, since we haven't really seen this as generations have moved on since vaccination, we could be at risk of getting these things if they're ever released back out into the public. Now, we've eliminated them, but there are places in the world that carry these strains, and they're kept under tight wraps. However, if they ever get out, they could be a potential biological weapon. Okay, now in the United States, the routine vaccination ended in 1972. So if you're younger than 1972, so if you're younger than about 43, 44 years old, you probably weren't vaccinated for it. Those that have been vaccinated, and again, if you're from another country, you may have seen this scar that's on your shoulder. And so this is kind of the scar, and it's due to the barbed nature of the needle that they use. They kind of use this needle that kind of goes in, and it kind of does this cross-hatching thing, and it kind of leaves this nasty little indentation or scar in the skin. So if you have that in your shoulder somewhere on either your right or left shoulder, that indicates that you've been vaccinated for smallpox and you're not at risk of ever getting it. Most of us that are younger than the age of 40 are at risk because we haven't been vaccinated for it. Now, if you served in the military or you're military personnel, you may have been vaccinated while in training or in boot camp or one of those things because, again, the risk of a biological weapon. And so the reason why they're vaccinating people that are in the military is because you'd be at the first line of defense. And so, again, if they used a biological weapon on you that was smallpox, They don't want to wipe out the army based on, getting smallpox infections and that and spreading very quickly in the barracks and everything else. And so one way to prevent that is vaccinating. And so again, they've now been vaccinating since 2002. So if you've served since then, you may have been vaccinated, and again, you may have that scar on your shoulder. So if you have that scar on either one of your shoulders, you've been vaccinated for smallpox. Okay. Another one that's out there that tends to be a little bit smaller, and we see this as an STD a lot of times, is this Musculum contagiosum. And these are these small little bumps that form around the genitalia area. And again, it's endemic in areas, and it's primarily an infection in children. It can be transmitted by direct contact. It also can be transmitted if a virus gets onto surfaces and can spread. It's most commonly an STD that's spread among people through sexual contact, and these are small little smooth macules. They look like little pimples or bumps around the genitalia. And again, they grow in the genitalia area and the thighs. AIDS patients can suffer a much worse form that attacks the skin and form tumors. And again, typically this is done just like warts would be. These are not genital warts or anything else. That's a different virus. But again, the treatment is pretty much the same. You can freeze them, cauterize them, or use chemical agents to remove these different things. And again, it's more of a appearance thing than anything else. And again, we do see this as an STD in the United States. We also see it in young kids being spread back and forth, and again, through handling or fomites and other things like that. Okay, so that's the one that's related to these different viruses. Now, there are other pox viruses, including cowpox, rabbit pox, mouse pox, and elephant pox. Again, typically most people think, oh, chickenpox has got to be part of that, but it is not. Chickenpox is a herpes virus, and we'll talk about that here in a minute. Again, humans are susceptible to monkeypox and cowpox. Again, in Wisconsin, since we're a dairy state, we have lots of cows around here. There is a chance that you may see cowpox, and that would be these bumps and growths on people's hands, typically involved with the dairy industry. Now, we don't typically milk cows anymore by hand. We have machines that do it, so we don't see these infections very often. But I just want to point this out to any of you nurses or doctors that are going on to be doctors that are going to work in the areas where you have lots of dairy cattle and that, you may see some cowpox. Monkeypox is a rare disease, but we do have some cases. In Milwaukee, there was a case or two of monkeypox about 5 years ago. But again, it was isolated, treated, and the person survived, so it's not a big thing. But you do see this occasionally, and again, this is taken from areas, endemic areas, and then brought back. Typically not found in the population, but it can happen, and so there are these occasional cases of these things. Okay, and when it does happen, obviously go to the doctor. Okay, so which of the following is not caused by the pox virus? Is it Musculum contagiosum, smallpox, cowpox, or chickenpox? Hopefully you've been listening to me pretty carefully here in the last 10 minutes. What do you think it is? You said chickenpox. You are correct. Chickenpox is a herpes virus. The rest of them are in the family of the pox viruses. Okay? All right, so let's move on to the herpes virus. And so I always like to give herpes the great name of the gift that keeps on giving, because once you get it, you never get rid of it. And so that's something that you keep the rest of your life. And again, there are many forms of herpes, so I don't want you just to assume, oh, cold sores or genital sores or whatever, but there's lots of other things. Chickenpox is a herpes virus. CMV or cytomegalovirus is a herpes virus. Epstein-Barr virus is that causes mononucleosis, is a herpes virus. And there's some other ones out there that also cause some diseases. Now, we're first going to talk about HSV-1 and HSV-2, which are the ones that cause cold sores and genital sores. But then we'll get into the zoster, the Varicella-zoster virus, which is the chickenpox and shingles. And then again, we'll talk about some of these other ones. And so again, all members show latency and cause reoccurring infections. And obviously, you know, if you've had one of these infections, if you've had chickenpox as a kid, you're at risk to getting shingles later in life. This is the shingles here. And again, clinical complications include latency, becoming more severe with advancing age because of the weakening of the immune system. Cancer, chemotherapy, and other complications or conditions can complicate the situation as well. So if you go on immunosuppressive drugs, you could see these things come out, cause disease, other things. Even things as simple as getting a sunburn or getting in the sun UV exposure can trigger some of these things to come out as well. And so we do see this sometimes in the summertime where people get shingles based on getting a really bad sunburn and that, because again, the weakening of the immune system and that stuff. Obviously, where we worry the most is in the immunocompromised. The conditions are always more severe, always more complicated whenever the immune system is not functioning properly. And so that's where we see these problems that really arise. Again, the herpes virus is a large envelope icosahedral double-stranded DNA. You can see the icosahedral on the inside. Here's the double-stranded DNA, and then the envelope with the spikes. The spikes are the keys that allow it to bind to the cells. Here's a picture of it under an electron microscope, and again, you can see the outer envelope, and then you have the DNA on the inside, and then the capsid on the outside. And you can kind of see the icosahedral on the outside here. It's not really easy, but you can kind of see some of that. Okay? All right. Here's a large family of herpes viruses. Again, the HSV-1 and 2 are herpes 1 and 2, simplex 1 and 2, and again, cold sores, genital sores. The VZV, which is Varicella-zoster virus. CMV, what is the cytomegalovirus. EBV, which is Epstein-Barr. Then we have HHV6, HHV7, and HHV8. And some of these are now associated with some other diseases, and I'll discuss those as we get to them. One of them is a major cause of Kaposi sarcoma that we see in AIDS patients. Another one, I believe it's HHV7, has been associated with MS, and so that could be one of those that causes a triggering or attacking of the nerves. And so that is one that we are seeing more and more a causality of having this virus and having MS as well. So there might be some link to that as we look. Okay, so the first two we're going to look at are the simplex viruses. And again, HSV-1 is typically found on the oral pharynx, so on the face, around the mouth, the nose, or the eyes. And again, typically occurs in early childhood, but can go on throughout the rest of that person's life. Again, it can be spread through typical fluid secretion, so a mom kissing a baby or any of those different things is always the typical way these things spread. But any fluid contact between person to person is how these things spread. HSV-2 is the one that's called genital herpes. Typically you get, sometimes it can spread orally, so if you practice oral sex on someone that's infected, they can spread that disease to you in the oral cavity and oral area. Again, occurs typically in the sexually active areas between 14 and 29, but it's not uncommon to see this as an infection that goes on later in life, especially if you're promiscuous and have multiple partners in that, and it can be spread without visible lesions. And so you may have seen some of these commercials like Valtrex and that saying, well, I don't have an outbreak now, but I could still spread it, and that is true. So even though you don't have an outbreak going on at that time and open wounds, those things could still spread to your partner. And so you always want to make sure that your partner knows what you're carrying with you. If you know, you have the right to tell your partner those things and that stuff. And so there are cases where, fought in court where people say, I didn't know they had it, they knew they had it, and they tried to give it to me, or they gave it to me for that case, okay? And so that's those are those things. Now again, HSV-1, if we look over here, this is typically around the oral cavity, the face, the eyes, the nose. HSV-2 is found typically in the genitalia. Again, close contact, usually of the face. This is going to be either sexual or intimate contact. Latency usually occurs where the virus actually hangs out is in the trigeminal nerves in the back of the head, of the cranial nerves. And then the latency, again, sits typically in the sacral ganglia of the lower back for the genitals. The skin lesions typically are on the face or on the mouth, and then the internal, external genitalia, sometimes on the other side on the buttocks and some of those areas, but typically in the lower regions. Complications can occur. Now, this can occur if you're a nurse treating someone with these infections and you have open wounds. You can actually get whitlows, which can occur on wounds that you have an open wound. Let's say you have a cut on your finger and you're treating someone and you don't know that they actually have herpes. That herpes virus can get in and actually cause what is called herpetic whitlow, and we'll look at that as well. Obviously, if you're an OB/GYN or a nurse working in that area, that's always a risk that you take with those things. So always wearing gloves and making sure that you handle everything with caution. And then neonatal encephalitis can occur up to about 30% in newborns with the HSV-1. And again, most cases with HSV-2 are spread through live birth during the delivery. through the birth canal and contact that way. And so again, the one that typically spreads over the placenta is the HSV-1, and the HSV-2 is typically one that you get through direct contact with the genitals. All right, so again, when we look at transmission by direct exposure to secretions containing the virus, and again, active lesions are the most significant source, and so anyone that has a cold sore or anything else, you're going to be at more risk than when someone doesn't have it. And again, typically where the virus sits is in the trigeminal nerve in here. In the trigeminal nerve, it sits in the back and it contains the 3 cranial nerves. And so that's why herpes can go to anywhere in the face, basically. It can sit in the lower mandible region, it can sit in the maxillary region, infect the nose through the nerve here, or even get up into the eye. And so some people will get herpes infections of the eyelid and the ophthalmic region, and so that can be pretty serious because that could lead to scarring and damage of the vision, and damage of vision and that stuff, especially if it gets in the eye. Now, HSV-1 enters the 5th cranial nerve, where HSV-2 sits in the lower back. So if you think of the lower back and the ganglia sitting back there, that's where the virus hangs out. So these guys have an affinity, once they infect the epithelial cells, to go back into the nerves and then hide out in the nerves. And really a lot of the herpes viruses, that's where these guys hide out, or in our nerve cells. Okay, and again, that's because our immune system doesn't really attack those cells at all. Okay, again, recurrent infection is triggered by various stimuli. This could be fever, so we call these fever blisters. UV radiation, stress can bring this on. If you're worried about a big test or trying to graduate, that can bring it on. Mechanical injury can also bring that on and cause these things to occur. And again, newly formed viruses migrate to the body surfaces, producing a local skin. And a lot of times people that have herpes infections, a lot of times can feel the infection coming because they feel the tingling of the nerve. And so that's the virus actually traveling up the nerve, and then you have the outbreak. So a lot of times you feel that sense maybe the day before you have an outbreak, you kind of feel the tingling in the nerves or maybe a numbness in the nerves, and that signals that, an outbreak is going to occur. Now again, where we look at this, we look at how many people actually have herpes. That's in the millions and again tens of millions range. And so again, 45 million have genital herpes, and it's probably the most prevalent STD that we have in this country. HPV is about 20 million, but that's really a silent infection a lot of times. There's not a lot of times where you actually see the infection. And again, a lot of people don't know they have the infection. With herpes, you will know because you'll have those sores and that. And it says 1 in 5 over the age of 14 actually have herpes. And so that's a kind of a scary number to think about. And again, transmission. Where does most of the transmission occur? Well, when people think they're, I don't have any outbreak, I don't have any sores or anything else, they're unprotected, and that's where it spreads, okay? It's when they're asymptomatic. So up to 70% of asymptomatic carriers, or at the time that have the disease and not having any symptoms, spread the disease. 30% have transmission during a symptomatic outbreak. And so again, typically you see that with more partners, but again, you can see this in a lot of different areas where, again, promiscuous, multiple partners, and spreading throughout. And so again, you'll see how these things spread very easily. And again, the idea is think of the ages sexually active, and again, especially in the younger generations, but we do see quite a few in the older populations too. And so one of the places you can probably never think about with STDs and that stuff is actually in nursing homes now. And so I'll let you guys think about that while we go on in the discussion. But we do see an increase of some of these STDs as we actually get older into the nursing homes. Okay, so some of the infections that we see. So the first one is the most common type, the fever blisters and cold sores. This is the herpes labialis, and again, this is the most common HSV-1, and this is the cold sore on the lips, and again, or right above the lips and that stuff. And again, you get the mucocutaneous junction of the lips or adjacent skin. You get the itching and tingling prior to vesicle formation, and typically 2 to 3 days it heals over, crust over, and it heals, and then it goes away, and then you get this infection again and again. Other ones can include the gingiostomatitis, which is again the oropharynx of young children. Sometimes you get these swollen lymph nodes. You can see the sores, these sores on the under the tongue, and some of these other things are referred to as canker sores. Now, I don't want to put out there and say that all canker sores are herpes. anytime you have a sore in your mouth, that is referred to a canker sore, but a lot of times these canker sores are due to herpes infections, and obviously this is a pretty nasty one in this case. Now, another one that can occur is keratitis, which again is the ocular herpes, and this can occur where you get this inflammation of the eye, gritty feeling, can cause conjunctivitis, pink eye, sharp pain, sensitivity to light, could lead to vision loss if not treated, and that it can cause some damage again to the skin and the eyelid and can be pretty nasty. A lot of oozing and pus formation in the eye area that can cause, and obviously something that you don't really want, and so you'd go and take an antiviral to help treat the symptoms. It's never going to cure it, but it's going to help make it progress a lot faster, so you don't have to suffer through the symptoms as long and over time. Okay. Now, the herpes type 2, these are the genital herpes, and again, this is the herpes of the genitalia. You can see it can start with malaise, anorexia, fever, and bilateral swelling. Sometimes you get tenderness in the groin. You get these clusters of sensitive vesicles around the genitalia, perineum, and the buttocks, urethritis, painful urination, cervicitis, itching, and vesicles can ulcerate and become very painful. And again, these can be recurrent bouts, but as they keep coming back, they can be less severe. A lot of times that can cause this is menstruation, stress, and bacterial or yeast infections can bring this about. And again, where do we see transmission? A lot of times when people are asymptomatic. They think, oh, I don't have any problems, I'll have sex, and then they spread the disease to an unknowing partner at that time. Okay? And so that's what you think about there. Now, again, herpes of the newborn can occur either with HSV-1 or 2, can be potentially fatal in the neonatal fetus, especially if the virus crosses the placenta, and typically it's contaminated by the mother before or during birth, hand transmission while handling the baby. If they do have the infection, they touch the cold sore, they can transfer it this way, or kissing the baby. Infection in the mouth, skin, or eyes, it can get into the central nervous system where you have these severe infections and can cause again, I think it was meningitis and that of the brain, swelling of the brain. And again, preventative screening for pregnant women, and always, telling your doctor that you do have it. And if that is going on, then a C-section will most likely be done before birth or during the time of birth, so that you don't pass this on to your baby. Okay? And so that's very common in those situations. Now, this is what I was mentioning before, that this can be a common thing that can occur, and this is known as herpetic whitlow. And this is the herpes virus infection of the fingers, and this can be because you have an open wound and the virus actually gets in either touching cold sores or other areas. And so if you have an open wound, this can be cause these infections. Typically, it's a localized infection of the herpes virus and in one finger, but it can be extremely itchy and painful, and obviously that does not look very pleasant in that right there. And so this can be something that you could get where if you're treating someone without wearing gloves and you have a cut, that this could spread. Okay, HSV-1 encephalitis can occur, but it's a very rare form of viral encephalitis, but it can occur when it goes into the cranial nerves. It could always work back into the brain. And then again, those with underlying immunodeficiency are more prone to more severe and disseminated cases of herpes. So again, the less of immune system you have, the more likely these infections are going to be worse. Okay? Now, diagnosis, treatment, and control of herpes. Again, vesicles and exudate are the typical diagnostic forms. You can do scrapings at the base of the lesions, look for giant cells. So here's a giant cell with multinuclei, and this is an inclusion showing you that this is an virally infected cell. Again, specific tests are given to diagnose HSV, and direct fluorescent antibody tests are there. Here are a number of the different treatments. Acyclovir, famclavir, valciclovir, and topical medications are given. Valtrex is the most common one. You may see this as a topical treatment or over-the-counter type of thing. There are also some topicals that will help heal the wound, and so again, speed up healing and that stuff. But there is no cure for this. There's no vaccine for herpes, and so this is one of those things that preventative treatment or preventative care is the way to keep from getting this thing. So obviously, using protection when you're having sex, and being careful when the person does have an outbreak not to exchange body fluids or anything else at that time, especially with the oral. No kissing, no contact, because the virus can spread at this time. No sharing water bottles or anything like this, and so that can also trigger a spread of the disease. Okay, so which one does herpes simplex 1 cause and which one does herpes simplex 2 cause? Is it cold sores and genital herpes, fever blisters and cold sores, canker sores and fever blisters, shingles and stomitis? What is it? You said cold sores and genital herpes. If you've been listening for the last couple of minutes, you know it's cold sores and genital herpes. You got it right. Okay, so let's move on to the Varicella-zoster virus, which is chickenpox. Again, this is the VZV. It causes chickenpox, and if you had chickenpox, you're now at risk for getting shingles later in life. Humans are the only natural host in this, and again, it's transmitted by respiratory droplets and direct contact from person to person. Primary infection is the chickenpox, and that is the characteristic vesicles that develop. And again, the reason why it's called the pox is because you get the same kind of similar pox type of infection that you see with smallpox or monkeypox. But again, it is not a pox virus, it's a herpes virus. And then it enters your neurons and remains latent until later in life. And then it can come back as shingles. Okay, and so later reactivation results in shingles and results in localized distinctive areas or dermatomes. And again, what happens is that the virus leaves the nerve, travels along the passage of the nerve, and causes an outbreak. So you can see here the direct passage of the virus from the spinal cord all the way down the arm, and that's typically what we see with shingles. A lot of times you see it on the upper back, the lower back, you can see it on the face, you can see it on the legs, you can see it in many different places, and typically it follows the pathway of the nerve. And so if you have the nerve in there, it can follow that pathway, and that's typically where you see it. Now again, it's more common in older patients, but we are seeing this in younger patients in their 20s and 30s. So it is one of those things. If you've had the chickenpox, you're likely to get shingles. I think it's 1 in 3 are likely to get shingles sometime in their life. Basically, what you do is you treat the symptoms. It's going to be very painful, especially if it's on your back. You're not going to be able to sleep on your back because it feels like pins and needles. Again, a antiviral helps speed up the healing. Again, it's no cure, but it will help the healing and the progression of the disease and work a lot faster so that you don't suffer as long. There is a vaccine now for those that for chickenpox early in life. And so as young kids now, most young kids probably under the age of 20 have not had chickenpox because they've been vaccinated. This came out in the late 1980s. And so if you're a 90s child, you probably have been vaccinated for chickenpox and never have it. And that's a good thing because then you never will be at risk for shingles. However, those that do have chickenpox, they do recommend as you get older to get vaccinated for the shingles so that it may actually help prevent the outbreak of shingles as you get older. So again, but they think of it as a later disease, so it doesn't help those that get the shingles in their 20s and 30s. They typically recommend it for those in their 50s or 60s so that you can avoid getting the shingles there. Okay? So not like when we were kids, so a lot of you guys are older like me or in your 30s, you probably got chickenpox and your moms decided to put all of the kids together so you'd all get it at once, called them the chickenpox parties, and everyone would get the chickenpox, you'd suffer through it for 2 weeks, and then you'd move on. Okay, and then now with the vaccination, we don't see this anymore, and again, now that we have the chickenpox in us, we're at risk for shingles, and so you could see this again later in life. Okay, another virus that's caused by herpes virus is the CMV, and this is called cytomegalovirus. It produces these giant cells with cytoplasmic inclusions. It's transmitted by saliva, respiratory mucus, breast milk, urine, semen, and cervical secretions, so it's transmitted through bodily fluids. It's commonly latent of the various tissues, and most infections are asymptomatic. So most people have this and never have any idea that they have this virus in them. The places that we see a more virulent form of the disease are in young kids, newborns, fetuses, and in immunodeficient adults. So again, typically we've probably been infected by this some point in time in our lives. It hides in us, doesn't really do much unless we have a condition where our immune system is weakened. If that's the case, then CMV can cause some serious problems, can cause some serious diseases, flu-like symptoms, and can be a very serious complication to those that are immune deficient. Okay. Again, newborns may exhibit an enlarged liver, spleen, jaundice, capillary bleeding, microencephaly, and ocular inflammation, and could be fatal. Babies who do survive can develop neurological sequelae, meaning other problems that can occur, including hearing, visual disturbances, and mental retardation. Prenatal CMV, mostly asymptomatic, but can lead to pneumonitis and is in mononucleus-like syndrome. And then AIDS patients, CMV can cause mononucleosis, disseminated CMV, and rhinitis. Okay. And then transplant patients can get pneumonis, hepatitis, myocarditis, and meningoencephalitis. Okay, so some of these different diseases that can affect. And again, treatment is reserved for the immunocompromised, and again, to weaken the symptoms, to lessen the symptoms so that they can survive. And so that's where you're going to get it. And so again, immunocompromised, they're going to be the biggest risk: babies, neonates, and the immunocompromised with this disease. Most of us doesn't affect us at all. Okay, another one that you may have gotten when you were a young kid is known as Epstein-Barr virus, or EBV. It's a ubiquitous virus that infects the lymphoid tissue and salivary glands. Its transmission is through direct oral contact or contamination with saliva. So a lot of times this is known as the kissing disease because it's spread between person to person or sharing water bottles. So we see this especially in kids and teenagers that share water bottles. In industrialized countries, college-age population is the most infectious. This is mononucleosis, or the kissing disease. And they say by midlife, most of us, 90 to 95%, have been infected with this virus. And so some of us have had mono, and you know what that is like, where you have the long-term chronic tiredness, aching, pains, feel like you've just been sick for a long period of time. And really the biggest thing is just the tiredness that is associated with mono. Mono is one of those that can really knock you down for a long period of time. And it seems if you get it younger in life, the more likely you're going to have infection, or more likely you're going to have symptoms. The older you are, the less likely you're going to have symptoms in that with this. And anyone with immune deficiency is highly susceptible to EBV. Now, the virus does hang out and can cause infectious mononucleosis, which is a sore throat, high fever, cervical lymphopathy, and can develop anywhere after a 30 or 50 day period. Now, one of these things that can occur in this case with the Epstein-Barr is that it does sit in B cells, and B cells are our immune system, but it could be reactivated and could lead to actually lymphomas. And so we do know that this can actually lead to cancer in people that had EBV. And so again, most of us have been infected at some point in time, so that could be one of those things that could lead to a lymphoma sometime in our life. And it's probably going to be more likely in someone that has had an activated or a case of mononucleosis in that case. Okay. Other things that can occur, this is the Burkitt's lymphoma. Like I said, the B cell develops malignancy, usually develops in the jaw and grossly swells the cheek. Central African children, anywhere from 4 to 8 years old, seem to have the most symptoms. It may be associated with chronic co-infections with malaria and other things. Here you can see the swelling of the cheek and the facial cavity. Another one is the nasopharyngeal sarcoma. This is a malignancy of epithelial cell, and it occurs in older Chinese and African men. And again, it has a lot to do with the cell types and other things. But again, these things tend to sit in the B cells, and the B cells travel all over the body, so that can bring into those spots where you see these infections. And again, like I said, with the B cells, that can always lead to some type of lymphoma or cancer of the B cell. Okay? All right, how do we diagnose, treatment, and prevent? Well, again, blood count shows lymphocytosis, neutropenia, and large atypical lymphocytes because we know that it infects the B cells. Okay, serological assays can detect antibodies and antigens, so that's how they can test for mononucleosis. So it's again another blood test. Treatment is directly to have relief of the symptoms of fever and sore throat, and again, long periods of rest and that stuff. Getting your rest will help, but again, it just kind of overwhelms you because it kind of affects the whole body. A disseminated disease may be treated with IV gamma globulin, interferon, acyclovir, or monoclonal antibodies, especially if you're in one of those severe cases where you have malignancy or other things that are going on that can really cause a lot of systemic disease. All right, other herpes viruses include the HSV-6 or human herpes virus 6. This is the B-lymptropic virus. It's transmitted through contact with saliva and other secretions. Causes rosella, which is an acute febrile disease in babies 2 to 12 months, and begins with a fever followed by a macular papular rash, and it's usually self-limited. Here's the example of the rash you might see. So it's kind of all over, and again, very young, immune system's not working very well. It can cause this disease, and again, spread through parents to children with close contact. Okay, another one with HSV-6 is the human B lymphtrophic virus. Adults may get mono-like symptoms, lymphopathy, and hepatitis. And this is the one that you see 70% of all MS patients actually show signs of this infection. And so it might have something to do with this virus affecting the nerves and then the immune system attacking the nerves. Now, again, we're seeing this. We don't know if there's a cause-effect relationship, but again, it seems like there's a pretty good number that have MS and are showing signs of this viral infection. Other relationships include HHV-6 with Hodgkin's lymphoma, oral carcinoma, and certain T-cell leukemias, again, because they infect the immune system. These can cause these different cancers, and a virus getting into a cell can always lead to the development of cancers. Another one is HHV-7, which is closely related to HHV-6. One of those things that we do see with HHV-8 is Kaposi sarcoma, which is linked with common tumor in AIDS patients. Also might be involved with multiple myeloma. And again, this is probably what you see. These are those tumor-like growths that you see on AIDS patients, and a lot of times because the immune system is weakened, you start to see these secondary infections like HHV-8 causing these tumor-like growths on the skin. And so we see those different things. Okay, so the Varicella and the zoster virus are caused by what? The same virus, two different strains of VZV, herpes simplex and herpes zoster, or CMV and VCV. So what is the Varicella and zoster? Varicella is chickenpox, zoster is shingles. Is it the same virus, different strains, or something else? And if you said the same strains, you got it right. You knew that already, right? And so Varicella and zoster are the same virus. One causes chickenpox, the other one causes the shingles. And again, it's through the progression over a long period of time, incubating in the nerves. Okay, so the next thing we're going to look at is hepatitis B. Hepatitis is an infection of the liver, and anytime you have an infection of the liver, it's designated as hepatitis. And we have a number of different types that are out there. Okay, the main type that we're going to talk about today is hepatitis B, but there is hepatitis A and C, and we're going to look at those next time in chapter 25. But hepatitis is an inflammatory disease of liver cells that may result from several different viruses. Interferes with the liver's excretion of bile, pigments, and bilirubin accumulates in the blood in the tissues causing jaundice. And so you know when someone has a problem with their liver when you start to see the yellowing of their skin, and especially in the whites of their eyes. If you see yellowing in there, that means they're having some kind of liver dysfunction because the bilirubin is not getting processed properly and it's now getting into the blood, and now you're starting to see that either in the skin or especially in the eyes. The three principal viruses involved: hepatitis B, which we're going to discuss today, and then hepatitis A and C, which we'll discuss in chapter 25. Now again, here are the three different diseases. Again, A and C are RNA. Today we're going to look at DNA. It does have an envelope. It has serum, other symptoms or older symptoms. They're known as serum hepatitis. It's endemic. Chronic carriers, contact with blood, serum, sexual or intimate contact. Incubation periods anywhere from 1 to 6 months. Fever, rash, arthritis are associated. Jaundice is very common with this infection. It can be gradual and chronic for the duration. And again, chronic active hepatitis can lead to cirrhosis and hepatic cancers. And so you have an increase of cancers in that. Here's the incidence rate. Obviously, the highest incidence is with HPV. The nice thing is there is a vaccine for HPV. And so one of those things is that if you're going to be a medical personnel, they highly, highly recommend that you get this vaccine. If you work with blood or blood products or anything else, I highly recommend getting this vaccination. It's required in 3 shots. First one, and then you wait 6 weeks to get the second one, and then you go 6 months, and then you get the third shot, and then they test you to make sure that you are properly vaccinated for it. And once you're vaccinated for it, you're not at risk of catching it. But especially in the medical condition, you don't know what people have in their blood at the time. You may get poked, you may get pricked. And again, HPV is one of those viruses that can survive on surfaces for up to 2 weeks. So it's a pretty nasty virus in the sense that it can survive outside the body for a long duration of time. Okay, so the hepatidNA virus, which is HPV, or hepatitis B, is enveloped DNA viruses. It's never been grown in culture, in tissue culture. And it's usually a genome containing both double and single-stranded DNA, and it has a tropism for the liver, meaning that it's going to go to the liver. That's where the locks are for the keys to bind, and so that's where you see those things forming. Okay, multiplies exclusively in the liver, which continuously seeds the blood with viruses, and that becomes a chronic condition. It gets up to about 10 to the 7th virions in the blood, so you do see that. And you get minute amounts in blood. Blood products can transmit infection, and it can be sexually transmitted. So again, unprotected sex can transmit this disease. High incidence, again, among homosexuals and drug addicts, again, sharing needles and those things, can become a chronic infection, and you increase the risk of liver cancer due to this infection because, again, the virus gets into the liver, can cause those things, and cause. Again, risk factors, people who share needles, health workers who are exposed to infected blood, and again, pain in the upper right quadrant of the abdomen, nausea, vomiting, loss of appetite. Jaundice is the big thing. Anytime you have liver involvement, you get jaundice, fatigue, and itching due to the rash that occurs with this virus. Okay, so some of the typical symptoms that you see with this includes a rash, enlarged liver, which will lead to the pain and tenderness that you have in the upper abdomen. Jaundice, or the yellowing of the skin, can get arthritis associated with this, fever, and low white blood cell counts, all associated with hepatitis B. Now, again, when you get this pathogenesis, the virus does enter in through a break of the skin or the mucous membranes through injection into the bloodstream. Okay, reaches the liver cells and multiplies and releases viruses into the blood in an average about 7-week incubation. Again, most people exhibit few symptoms and actually develop immunity. So the nice thing about it, even if you're exposed, most of us become asymptomatic carriers, which means we don't have any disease, but we can carry the disease to other people. Some experience malaise, fever, chills, abdominal discomfort, and diarrhea. Others will experience fever, jaundice, rash, arthritis, and then in the most severe cases, again, in some number of patients develop chronic liver disease, and that would be long term. And if you look over here, this kind of just shows you where people get it. So again, with HBV, only about 10% of the people actually show any infection at all. 70% of those become asymptomatic characters, and only 30% go into the hepatitis, where again it may resolve, may turn into cirrhosis, or again could get into liver cancer. So again, with HPV or HBV, you have a low risk of actually getting the infection and actually getting the symptoms involved with the infection. It is very typical to spread through the blood, so a lot of people could become asymptomatic carriers, but there is a risk for increased liver cancer, liver damage, and that stuff when you get the disease. And so we're going to be talking about HCV in the next lecture, and again, you can see that you become about 85% actually will develop some weak immunity towards it and either become asymptomatic chronic carriers, or about 50% of those will develop into severe cases. So HCV by far is more likely to give you cancer and other things. More people show symptoms and cause more infections. But like I said, most of the time with HBV, it's a small population that actually gets any liver damage associated with these things. HCV is another story, and we'll talk about that next time. Okay, diagnosis is based on the examination of risk factors, serological test, again, looking at the blood, doing a ELISA test. You can screen the blood for transfusion, semen of sperm banks, organs for transplants, all look for HBV to see if it's present. And again, mild cases are managed with treatment and supportive care. Chronic infections are treated with interferon. And again, if you get to this area where you get cirrhosis and liver damage, it may result into transplant or even into death if things continue on. Okay, and so again, this is the testing, screening, and again, looking at those different things. And I'm not going to spend a lot of time on that, but that just shows you kind of how we can determine if someone is positive or negative, and again, looking for the antigens in the blood itself. Okay. All right, how do we prevent HBV? And again, this is through the passive immunization. And again, there's that vaccine. Like I said, it's involved in 3 doses. Primary prevention is for high-risk individuals, encouraged for all newborns and infants. And so again, now we're vaccinating very early, and again, to prevent the spread through blood and blood products and that stuff, especially from asymptomatic carriers. And again, there's the 3 doses with the boosters. There's the vaccine is derived from purified sterile antigen extracted from carrier blood. And again, this is a vaccine that's produced for those that have allergies to yeast, because these things are grown. But this is the typical vaccine that we have, the 3 doses or 3 boosters.
one you get right away, 6 weeks, and then 6 months. There are some that, again, can get a passive immunization from antibodies that have been exposed. So again, there's ways to help people that have been exposed to HPV and haven't been vaccinated using passive antibodies from sources that have grown it up. Okay? All right, so we're getting close to the end. We're going to finish up with the non-enveloped DNA viruses. Again, the two that we're going to primarily talk about here are the adenoviruses and the papillomaviruses. These are the ones that cause the warts, and then we'll finish up with the parvoviruses, which are the single-cell DNA viruses. But these all are lacking in envelopes, so they just have the capsid, the spikes, and the DNA on the inside. Okay? So the adenoviruses are non-enveloped double-stranded DNA, and there are about 30 that are associated with disease in the adenovirus disease. Here you can see no envelope around the electron microscope. You can see the capsid and the icosahedral that you see associated with it. Some of the diseases that are associated include lymphoid tissue, respiratory, and intestinal epithelia, and conjunctiva. Oncogenic in animals, not so much in humans, and it's spread through respiratory and ocular secretions. It can cause colds, pharyngitis, conjunctivitis, keratoconjunctivitis, acute hemorrhagic cystitis. And so a lot of these different diseases. So one of the typical ones that we get are colds, can cause conjunctivitis or pink eye in a lot of cases. And again, the most severe cases can be treated with interferon, which helps stimulate the immune system. There is an inactivated polyvalent vaccine. I'm not sure how many people get vaccinated with that all the time, but there are vaccines for the adenovirus. Now, one of the things, an interesting story that I like to bring up real quickly, is the whole idea of the DNA therapy and putting genes back in. Well, one of the ways that they're thinking about doing it is actually using adenoviruses, because adenoviruses can actually bind to lots of different cells. Their keys are kind of like master keys, and they can bind to a lot of different things. And so one of the tests were actually run was using adenoviruses. Unfortunately, one of the patients died during this thing, and it kind of pushed back the research for a number of years. However, now bringing it back, and so this is one of those things. So take a look at the adenoviruses in gene therapy, and you'll read about those cases that they did in the early 1990s. Really set back gene therapy for a while because they thought that this was going to be not a way to survive, and anytime you have deaths of patients, that kind of puts a kibosh on a lot of research for a while. And so that's one of the things that really has kept this way. But one of the ways that they were thinking about delivering some of these new genes is through the use of viruses, and this is one of the viruses that they were thinking about, okay, is these adenoviruses. Now, the other one that we look at is the papilloma and polyoma viruses. These are small non-enveloped viruses. They have circular DNA, and these are cause of persistent infections in tumors. But primarily what we see with these guys, most of the human papilloma viruses are caused for these seed warts, or warts that we get on our hands or on our feet. And so most of these viruses are non-cancerous. Most of these, there's over 100 different strains, most of them non-cancerous. But we do worry about a few that can cause, and we do know cause, certain types of cancer. Okay, so the papilloma is a squamous epithelial cell growth, wart or vacua. Okay, it's caused by at least 100 different strains of HPV that are transmitted through direct contact or contaminated fomites. Incubation anywhere from 2 weeks to more than a year. So again, we were talking about athlete's foot and how things spread. Plantar's warts spread very easily in someone that has this infection on their feet. They go walking barefoot through a shower, like at the YMCA or another health club. You have bare feet, you may have a small cut on your skin, and then the virus comes in. And so that's where a lot of times these things get spread unknowingly through, walking around barefoot. So that's why they always recommend wearing flip-flops or other things when you're in a community shower to prevent some of these things like athlete's foot and these plantar warts from actually occurring. Those common warts regress over time. They can be removed through direct cauterization, chemical application, freezing, or laser surgery, and these warts can reoccur because it is a virus. And so typically we get the warts on the fingers or on the feet. That's the typical ones that we see. Now, again, the common seed warts are the painless, elevated, rough growth that we find on our fingers and other parts. The plantar warts are the deeper warts that we find in the feet. They can be very painful because we put a lot of pressure down on our feet, and so that can cause a lot of pain and be a source of a lot of pain. And again, they're not necessarily raised in this case, they're more underneath the skin. And so that's where you might see those. Another STD that can be caused are these genital warts. And again, these are warts on the genitalia. They can be tiny, flat, inconspicuous bumps to extensive branching and cauliflower-like masses around the genitalia. So again, spread through STD, sexual contact, unprotected sex, pretty spread, and it's a very, very common STD. Okay, and again, this is part of that HPV process. Now we know that there are about 9 HPV types that do show the increase in developing reproductive cancer, and about 2 of those 9 are actually 70% causing metastatic tumors. And again, early detection by inspection of the genitals, the pap smear for abnormal cervical cells, and screening. Always recommend yearly screenings for these things. They can test for HPV if it is in your cells, and it's not uncommon for people to be infected. I think the latest data that I heard is that over 1 million people are actually infected with the HPV virus, especially in younger women who are sexually active. And again, there are 2 vaccines for HPV. Now, there have been a lot of debate back and forth of really if they're effective. I highly recommend it, especially for those that are in the just the early ages of sexual contact and that type of thing. You know, the young kids from 14 to 26, I believe it's recommended from those that are 12 to 26. After about 26, it really doesn't do you a lot of good, so it's not really recommended for anyone older than that. But anyone younger and now becoming sexually active, that's where you want to be vaccinated. And so vaccines, again, are good to stopping the spread of this disease. And like I said, a lot of times it's asymptomatic. You don't know you get the disease until you start to see the symptoms, once you start seeing growth of tumors in that. And again, today I'm talking about more of the increase of reproductive cancer, but we're also seeing cancers in the throat, the mouth, the tongue, the lips, and other areas due to spread of HPV through oral sex or oral contamination in that case. Okay, so it's not just limited to the genital area. We're now seeing more incidents of throat cancers and other types of cancers through HPV as well. So I just want you to be aware of that as well. So again, safe sex. Again, multiple partners. You don't want to have multiple partners and that stuff. Or if you do, again, promote safe sex. Monogamy is always the best bet, and knowing your partner and that stuff. And again, getting your yearly pap smears. You can also test. If you're worried about HPV spread to your throat, you can always get screenings done there. But it's much easier to look for in women than it is in men in these situations. So I just put that out there just because I know a lot of you guys are in that range and you want to be aware of these things. A lot of times you don't know it, and some of your partners may actually have it and they don't know it either, and it could lead to infection later down the line. So that's one of those things. You don't want to develop cancer just because you were not being protective in your sexual behavior. Okay? So that's kind of my little stepping on the soapbox type of thing, trying to keep you guys protected. So, a patient complains of feeling tired and achy. You notice a pale rash on the patient's chest and a yellowish skin tone. What is the most likely infectious agent? Is it cytomegalovirus, hepatitis B, Epstein-Barr, or adenovirus? Which one do you think that would be? So think of jaundice. That's going to be your key there. If you said hepatitis B, you are correct. The jaundice or the yellow skin is going to be the key. Anytime you have liver involvement, jaundice is a clear symptom, and you know that something's going on in those situations. Okay, the last virus we're going to talk about, and then we're done for today, is the non-enveloped single-stranded DNA virus. And this is the Parvovirus. It's a small diameter in genome size, a very, very small genome, and it causes distemper in cats, enteric disease in dogs, and fatal cardiac infection in puppies. This is a lot of times the pet shop infection that you bring a dog home from the pet shop, and then 3 days later they start vomiting and getting really sick, and 3 days later they die, and that's due to the parvo. It's very infectious through animals, and again, primarily in the dogs and cats, and so we do vaccinate a lot of times for these things, especially when you hear about outbreaks, and you might hear this on the news. Don't bring your dog to the Humane Society or to the vet because of the outbreaks that are going on, but you can vaccinate your animals for this. We do bring this up because there are some infections in humans. Now, every time I say, oh, it's very rare in humans, I always get a student says, well, my mom had parvo and she spread it to my brother or whatever, and he got really, really sick. So it does happen in certain situations. I don't want to say it's very rare, but it is a rare disease that does it in humans. Typically, you're going to see this more in your dogs and cats, and this is again one of those things that can cause a very nasty disease in both the situations in both the dogs and cats that can lead to death. Okay, and so again, vaccination is the primary key to preventing that. Now in humans, we get two different diseases. There's the B19, which is known as the Fifth's disease. And again, it's a rash in childhood. Children may have fever and rash on their cheeks, and it can be severely fatal anemia that results if the pregnant woman transmits it to a virus to the fetus. And again, that's where we see most of the infections is in pregnant women transmitting it to the fetus, and it leads to death of the fetus. Again, you do see it occasionally in kids, but it's pretty rare in this, and it's not something if your dog has it, you're going to get it type of thing. It doesn't work that way, but typically it's spread from human to human contact. There is an adeno-associated virus that is also, it's a defective virus that can't replicate without the adenovirus that we do see sometimes, and it causes similar symptoms, but again, it's a very rare situation. Again, parvo, not very common in humans, but it does occur. Where you're going to see it mostly is in your dogs and cats. Okay, we made it to the end. Hopefully you paid attention to the diseases. Again, we spent most of our time with the herpes viruses. Again, those are probably the most prominent of the DNA. Obviously, papillomaviruses are always a scary thing, especially when you think of cancers and that stuff. But I want you to be aware, if you have a wart on your finger, it does not mean that you're going to die from cancer or anything else. Most of those human papillomaviruses that cause the warts on the fingers and the feet, the plantar warts, are non-cancerous. So I don't want you to worry about those, going out and worrying that you're going to die of cancer in the next day. Okay, so let's just kind of go quickly through our summary. We looked at our DNA viruses. Again, they have the DNA as a nucleic material. Most of them are double-stranded except Parvo, and again, that's the only one that is not double-stranded, and again, that's the only one. Then we can break it down between envelope, meaning they get the envelope when they leave the host cell, so it's a host cell membrane, and that includes the pox viruses, the herpes viruses, and the hepatitis virus. The pox viruses include things like smallpox, monkeypox, cowpox. Herpes virus includes the HSV-1 and 2, the cold sores and genital sores. Varicella-zoster, which is chickenpox, CMV, EBV, and then some of those other HHV, human herpes viruses that are associated with some other diseases, especially in those that are immunocompromised. The hepatitis virus is the hepatitis B. Hepatitis B is highly contagious, especially in blood products and that stuff, and meaning that if you come in contact with it, you can get infected. However, in most cases get resolved, and most people being asymptomatic. However, there are some that do develop chronic hepatitis B where they do show symptoms, and that could lead to damage to the liver and lead to progression to liver cancer. And again, that's in a small number. There is a vaccine for hepatitis B, so that's a good thing. And so again, if you're going to go working in the medical field, I highly recommend getting vaccinated for hepatitis B. And now they're even vaccinating young kids before you even have a choice type of thing. You're going to be vaccinated for it. The non-enveloped include the ones that don't have an envelope. This is just the capsid in the DNA. We talked briefly about the adenoviruses, and these are common for colds, sore throats, other things, eye conjunctivitis and that stuff, pink eye, and those that are viral associated. Papillomavirus, we talked about that. There's over 100 different types of papillomavirus. Most are non-cancerous. There are a few that are, and again, there are about 9 types, and of those 9, there are 2 that we know about 70% are all causing these different things. Prevention, obviously a big thing, safe sex, and that being smart about those types of practices, and then your yearly screenings will help diagnose and prevent further spread of cancer and other things like this. And so early diagnosis is always a good thing. And again, those in males, I don't want males to think, oh, you're out of the woods. We've seen an increase about, again, 70% of the oral cancers, the mouth, the throat, the tongue, are not due to smoking anymore. It's actually due to HPV. So if you practice oral sex or other intimate contact, and that you may actually get the disease, and it may be harbored in your cells. And so you might see that in those cases. So I just bring up that warning. Last one is the Parvovirus. Again, a very rare disease in humans, causes the 5th disease. It's a single-stranded DNA. I always like to ask that question on the test because that's about the only one that we ever hear about, single-stranded DNA. And again, it's most commonly seen in cats and dogs. And again, these are the ones you think of the puppy, the pet store, where it starts inducing the enteric vomiting, and again, the severe vomiting, and then the puppy dies 3 days later from parvo. Or in cats, the distemper. And again, cats and dogs get vaccinated for these things in their checkups and that stuff. And so they vaccinate to prevent the spread of this disease. Okay? So we made it to the end. If you have any questions about any of these DNA viruses, feel free to send me an email, send me a comment, whatever. Stop by my office during office hours or during the lab and that stuff. I'd be happy to talk to you about these things. Find these kind of interesting. The RNA viruses are just as interesting. And again, lots of different diseases that are caused by those things. Many more RNA viruses out there. You're going to see we're going to be talking a lot about flu and some of these other ones that are out there. It's a little bit longer lecture and that stuff, but it is the last one. Okay, so if you have any questions, let me know. I thank you for watching, and I'll see you next time.